You know, the layers of the abdomen are usually 6. If we from the cut for the skin, then the superficial fascia, but there is a no deep fascia. So, deep to the superficial fascia, there is directly the muscles. What are the muscles? Anteriorly, the rectus abdominis and lower down the pyramidalis. The rectus abdominis and pyramidalis are enclosed in a sheath known as the rectus sheath. And anterolaterally, there are 3 flat muscles corresponding to these flat muscles present in the intercostal spaces. What are the muscles in the antero? So we call the anterolateral muscles, because these muscles are present both anteriorly and laterally. So what are the muscles? External oblique, internal oblique and transversus abdominis. If we cut layer by layer all the 3 muscles, external oblique cut, then you will find the internal oblique. If we cut the internal oblique and reflect, you will find the transversus abdominis. If we then cut the transversus abdominis, you will find a fine fascia, transparent fascia. It is known as the fascia transversalis. Fascia transversalis. Fascia transversalis, which form the inner lining of the muscular wall. This fascia transversalis above, it is continuous with the fascia of the diaphragm, and midline anteriorly it attaches to the linea alba. What is linea alba? This white line is known as the linea alba, starting from the xiphoid process to the symphysis pubis. Why it is called linea alba? Because it is linea means linear and alba means white. It is whitish in nature and very tough and very least vascular. It is very least vascular. Blood vessels, blood supply is very less. So it has got an advantage and disadvantage in the surgical procedure. For example, if we try to a very emergency condition, very emergency, within seconds, we have to reach the abdominal organs. Then we cut along this, along the linea alba in the midline. What are the advantage? It is whitish tendinous structure. So no muscles are cut. So quickly we reach the abdomen. But if we go this pyramidian, you have to cut the layers after layer. You cut the skin, then reflect the superficial fascia, then cut the, suppose here, cut the rectus sheath, reflect the rectus, push the rectus abdominis muscle laterally, then we cut the posterior wall of the rectus sheath, then fascia transversus, then we reach this abdominal cavity. So it is very quick approach, no muscles are cut, bleeding is minimum because it is a less vascular, but surgeons do not prefer this except in emergency condition. Why? Because as it is a less vascular, when after the operation, when you stitch the linea alba, healing is very prolonged. Healing is very prolonged. For healing of the any cut, the blood supply is needed because blood carries these healing materials. You have know in the physiology what are the factors help in healing. But as the least vascular, healing is very prolonged. Number 2, there may be ugly scar. And after the most important, after the operation, as it is not muscular, the scar is very weak. So there is chance of protrusion of the abdominal organs through this cut of the abdomen, through the scar, going to post-operative hernia. So unless and except the emergency condition, we do not prefer the median incision. We prefer the other incision, para, median, subcostal, other incision. Better to take time, cut the muscles, and the operation will be very good. So it is about the linea alba. What is linea alba? Then how the structure is that? Last class I have told these muscles, external oblique, internal oblique and rectus abdominis are partly muscular. Here it is muscles tissues are present. It is muscular. But after certain extent medially, depending upon the external oblique, internal oblique and rectus abdominis, they become thin aponeurotic. Aponeurotic means flat, paper-like. So all the muscles are aponeurotic. External oblique, internal oblique and rectus abdominis is here it is a muscular, but when it comes here to cover this anterior wall of the abdomen, covering especially when it covers the rectus abdominis, passing in front of the rectus abdominis or behind the rectus abdominis, they become aponeurotic to form the rectus sheath. And all these aponeurosis, external oblique, internal oblique and transversus abdominis join in the midline, interlace means this, crisscross, interlace with each other to form this linea alba. So linea alba is nothing but the aponeurotic mixing of the fibers of the three flat muscles. So this is all about the linea alba. It extends from the xiphoid process to the symphysis pubis, right? And then it is so going back to the fascia transversalis covering the inner wall of the abdominal muscles. Above it is continuous under the diaphragm as a subdiaphragmatic fascia. Anteriorly it is attached to the linea alba and below it is attached to the inguinal ligament and iliac crest, where it meets with the fascia lata of the fascia iliaca of the thigh. And so it is about the fascia transversalis. And most important that you will learn afterwards, there is an oval gap. Gap means deficient, oval gap in the fascia transversalis. Here, just 1.25 centimeter above the mid-inguinal point. What is mid-inguinal point? If we join a line from the middle of the symphysis pubis to the anterior superior iliac spine, a line and midpoint of this line is known as the mid-inguinal point. Just 1.25 centimeter above the mid-inguinal point, there is an oval opening or a gap in the fascia transversalis and it is known as the deep inguinal ring. Deep to the fascia transversalis, there is a very important layer known as the fatty loose connective tissue layer known as the extraperitoneal layer. Fascia transversalis, extraperitoneal fatty tissue which contains fat. Not only that, কে বলবে কি থাকে extraperitoneal fatty tissue তে? কালকে বলেছিলাম কি থাকে? All the visceras. All the visceras of the abdomen not present within the peritoneal cavity. Peritoneal cavity is like that. It is more or less totally empty. This cavity lining the peritoneum is totally empty, contains a few cc of fluid. No viscera is present within this peritoneal cavity. The viscera are present the outside layer is the extraperitoneal fatty tissue. And outside it is the fascia transversalis. তারপরে muscles রয়েছে, skin রয়েছে, etc. So all the viscera actually present here, present here, present here. Right? When viscera enlarge during development and protrudes, it protrudes in this fashion. Suppose its stomach covering the peritoneum become like that. So, this is the extraperitoneal covering, and this layer of the peritoneum we call the visceral layer, and this layer is the peritoneal layer, and the peritoneal cavity remains empty, only fluid are present. Even the blood vessels supplying this viscera also present in this extraperitoneal fatty tissue. So, after the extraperitoneal fatty tissue, there is a lining of parietal peritoneum. So, these are the layers of the abdomen, 6 layers, but here it is reduced, I will come later on, lower part of the abdomen. So, this is the layers of the abdomen starting from the skin to the peritoneum. So, all the viscera are extraperitoneal only, but intra-abdominal. They are no doubt present within the abdominal cavity, but not present within the peritoneal cavity. In female, there is an only opening, there is some say, the ovary, there is an ovary with lining epithelium, a lining covering is continuous with the peritoneum. So, one may say the surface of the ovary is interperitoneal, but it is better to say it is a specific another thing. So, do not say this, all the more or less in roughly speaking, all the viscera are not within, it is not present within the peritoneal cavity. They are present in the extraperitoneal fatty tissue. Only thing open within the peritoneal cavity, the opening of the fallopian tube, so that ova discharge and received by the, that will, when you go to the female genital system, you will learn better. Do not try to put a headache on it like that. Now, all this about these layers, then we going to the anterior abdominal wall. Before going to the anterior abdominal wall, the muscles of the anterior abdominal wall, some aspect of the cutaneous nerves, that is very important, and one clinical anatomy can be answered to this. You know, 7th, 8th, 9th, 10th, 11th. It is the 6th, 7th, 8th, 9th, 10th, 11th, 12th. It is known as the costal arch, right? And the lowest point of the costal arch, if we draw a line, it is known as the subcostal line. And the tip of the 9th costal cartilage is very important, because we draw a transverse line along the tip of the 9th costal cartilage, it is known as the transpyloric plane. I have told you in the last class. It is known as the transpyloric plane, very important, because many important structures lie deep to this line. For example, fundus of the gallbladder, pylorus of the stomach, origin of the superior mesenteric artery, lower border of the L1 vertebra, often asked in the oral examination, the transpyloric plane. And this is when it passes to the 10th, the lowest part of the 10th rib, it is known as the subcostal. And this is known as the subcostal angle, whatever it may be. So, these are the ribs, and anterior to the ribs, you know, there is a costal cartilage. In the superficial fascia, there are present nerves which carry the sensation. Pain, touch, temperature, heat, cold are carried by the nerves, the superficial nerves. What are they? Peculiarly, these nerves are derived from the thoracic nerves. You know, the thoracic nerves are 12, thoracic 1, T1, T2, T3, T4, T5, T6, T7, T8, T9, T10, T11, and the last nerves is known as the T12 nerves, or another name is the subcostal nerve. Subcostal nerve. T12 nerve is the subcostal nerve. Every thoracic nerves, when we learn to the nervous system, you know, when it comes from the vertebral foramen, they divide into two. One is known as the posterior rami, posterior ramus, singular, plural is the rami. So, any nerve this is the spinal cord. This is the spinal nerve. It is the posterior root bola hoy, porosic bait, anterior root, the joint to form that and comes out from the vertebral foramen. And immediately coming out of the vertebral foramen, it divides into a posterior ramus, which goes posteriorly to supply the posterior part of the skin, sometimes muscle. And the anterior or the ventral rami, that is very important. The brachial plexus, lumbar plexus, all are found by the anterior ramus, anterior rami, not by the posterior. And these anterior rami of the thoracic nerves are called 11 pairs, T1 to T11 called the intercostal nerves. As T12 nerve passing under the costal arch, we give a special name, subcostal nerve. So, there are 11 pairs of intercostal nerves, T1, T2, T3, T4, anterior rami, which is present within the intercostal space, we call the intercostal nerves. And in the intercostal nerves, there are some typical, there are some atypical. T1 is not atypical, T2 is not atypical, it is atypical, there are certain exceptions. Come on, T1, which is mainly from the brachial plexus, not supply. Typical intercostal nerves are those, the ventral rami of the thoracic nerve, which their territory of distribution must be within the thorax, not outside it. So, T3 and T6, because for example, T2, it gives a lateral cutaneous, intercostobrachial nerve, very good. It is also lateral cutaneous nerve branch. Intercostobrachial nerve which supply the superior extremity, axilla, medial aspect of the axilla, arm. So, it is not atypical. T1 going to form the brachial plexus, not typical. T3 typical, T4 typical intercostal, T5, T6 typical, but T7 to T, even the subcostal nerve T12, T11 not typical, because they not only supply the thorax, they definitely supply the thoracic wall, definitely supply the intercostal muscles, but they also supply the abdominal wall as well as the abdominal muscles. So, they are not typical. So, abdominal cutaneous nerve supply is from the T7 to T11 and T12 nerves plus L1 nerves, lumbar 1 nerves. So, all this sensation, if we pinch it according to their distribution, they are carried by the T6, T7 to T12 and L1 nerves, lumbar 1 nerves. Whole nerves? No, only the ventral anterior primary rami or ventral ramus of these nerves, anterior and posterior. How they enter? Under the costal cartilage, origin of these muscles, internal oblique and transversus abdominis, the T7, T8, T9, T10, T11, and subcostal nerve, how do they enter? To the lateral under the ki ligament ache, median arcuate ligament, medial arcuate ligament and lateral arcuate ligament. Subcostal nerve enters the abdomen deep to the lateral arcuate ligament, and all these nerves arising from here, T7 to T11, under the costal arch through the digitations of the origin of the internal oblique and transversus abdominis. পরে আসবো অরিজিনটা জানলে। And they supply accordingly. T7 supply this area, T8 supply this area, T9 just, and the most important, it is the umbilicus or navel. T10 supply the umbilical region. T10, thoracic 10 supply the umbilical region. And you know, within the abdomen there is an organ known as the vermiform appendix. Inflammation of this appendix we call appendicitis. We call appendicitis. And appendix also, the sensation of the appendix, pain sensation of the receive are by the T10 segment of the spinal cord. Sorry, T10 not. T10 segment of the spinal cord through the autonomic nerves. But ultimately it goes to the T7. From the T7 goes to the brain to receive the sensation. তাহলে কি কমন হলো? Umbilical region also supplied by the T10 segment of the spinal cord, and appendix is also supplied by the T7 segment of the spinal cord. Appendix is not supplied by this T10 thoracic nerves. They are supplied by the autonomic nerves, but ultimately go to the spinal cord, and spinal cord has got some segment like the spinal cord T1, T2, T3, cervical 1, 2, 3, 4, 5, 6, 7, and both them reach the T7 segment. So any appendicular pain initially goes to the T7 segment, and brain cannot differentiate it, whether it coming from the skin or from the appendix, and as if brain thinks that coming from the skin region near the umbilicus. So appendicular pain initially is felt in the around the umbilical, para-umbilical region. So whenever there is an acute pain in the umbilicus, you may think of there may be chance of appendicitis. Later, when the inflammation sets in, peritoneum is involved, the pain is shifted to the right iliac fossa. But initially, brain cannot differentiate. So appendicular pain, initial part may be referred to the umbilical region due to same segmental supply. পরীক্ষায় কি লিখবো? Due to same segmental supply. What is this segment? Thoracic 10 segment. So it is an applied anatomy question. Next, T11 supply the below the umbilicus, T12 supply this. Then this L1 nerves, anterior primary rami of the lumbar 1 nerve is very important. Anterior primary, if it is a lumbar 1 segment of the spinal cord, this is posterior, the anterior rami is coming out, and this anterior rami we call the iliohypogastric nerve. কি নাম দেই? Iliohypogastric nerve. Ilio near the ilium region, hypogastrium as it passing present below the stomach. Iliohypogastric nerve. It is L1 nerve, and it after that origin it gives a branch known as the collateral branch, like the thoracic nerves. Intercostal nerves gives a collateral branch always. Similarly, L1 nerves gives a collateral branch, and this collateral branch is known as the ilio-inguinal nerve, very important nerve in the chapter of inguinal region, ilio-inguinal nerve, and it is the iliohypogastric nerve. So iliohypogastric nerve, ilio-inguinal nerve, the root value are same, L1, lumbar 1, anterior primary rami of lumbar 1 nerve. Iliohypogastric nerve, ultimately to supply the skin, it must be comes to the superficial fascia. Where it comes in the superficial fascia? In case of iliohypogastric nerve, it is becomes superficial fascia just 1.25 centimeter above the anterior superior iliac spine. Then it becomes come in the superficial fascia, and distribute accordingly in the lower part of the, just above the symphysis pubis. The most important, I have already told you, the ilio-inguinal nerve. Ilio-inguinal nerve. Ilio-inguinal nerve coming from the L1 nerve. It pierces, come to be superficial. খুব ভালো করে শোনো এটা আরেকটু বুঝবে when you learn, when you do the inguinal region. It pierces, it passing between initially, আরেকটা বলা হয়নি, all these nerves after the origin passing in a neurovascular plane. What is the neurovascular plane in the thorax? Between the internal intercostal and intercostalis intimus, second and third. In thorax, all the intercostal nerves, vessels are passing in a plane between two muscles. What are these two muscles? Not external intercostal or internal intercostal. Between the internal intercostal second layer and the third layer intercostalis intimus. It is known as the intercostalis neurovascular plane of the thorax. Similarly, abdomen, same thing. Intercostal internal is represented by the internal oblique and intercostalis intimus is represented by the transversus abdominis. So they pass in between the internal oblique and transversus abdominis. Then ilioinguinal nerve pierces the internal oblique muscle. ভালো করে শোনো, internal oblique, transversus abdominis. আর এইখানটায় রয়েছে, পরে শিখবে, inguinal canal. Inguinal canal. These nerves passing this ilioinguinal nerve, this is the internal oblique, forming the roof of the inguinal canal. So inguinal canal er pore shikbo amra, roof of the inguinal canal is formed by the, partly by the internal oblique. Eta hocche roof chhad, opore eta internal oblique ache. Now this is the ilioinguinal nerve, comes here, running between the in the neurovascular plane. What is the neurovascular plane? Internal oblique and transversus abdominis. Pass korche, korte. It pierces the roof of the, pierces the internal oblique. That's when it pierces the roof of the inguinal canal and enters the inguinal canal. দেখো ঢুকে গেছে কি internal inguinal canal এ? Then it courses along the internal canal and comes out through the superficial inguinal ring. What is superficial inguinal ring? I will just come within 5 to 10 minutes. Superficial inguinal rings and become superficial. So, ilioinguinal ring is a part content of the inguinal canal. So, ilioinguinal nerve is a part content, not total content. Total content ki? Those structures which passes from the deep ring, deep inguinal ring to superficial inguinal ring, ki jinish asbo ami, taki amra boli total content. But it is partly, because majkhan theke roof theke ঢুকেছে ও, কোনো দরজা দিয়ে ঢোকেনি। দুটো দরজা রয়েছে ইঙ্গুইনাল ক্যানেলের, একটা পেছনে একটা সামনে। হোয়াট আর দ্য ডোরস? পেছনে যেটা রয়েছে ল্যাটারালি, পেছনে বলা উচিত নয়, ল্যাটারালি অ্যান্ড পেছনে, বেটার টার্ম, সেটাকে বলে ডিপ ইঙ্গুইনাল রিং। আর সামনে যে দরজাটা রয়েছে, দুটো দরজা রয়েছে, একটা পেছনে ব্যাক সাইড অ্যান্ড posteriorly, deep inguinal ring, which is nothing but the opening in the fascia transversalis. আরেকটা রয়েছে এই সামনে, superficial inguinal ring, যেটা ওই দরজা দিয়ে they are entered through this door and come out through the door. This is the true content, total content, and this is the inguinal canal. But here the inguinal nerve, halfway it enters through the roof, then passing out through this door. So it is a part content, but it is a content. So ilioinguinal nerve comes out and it supply the anterior one, the skin of the scrotum. In case of a male, anterior 1/3 and screen of a labium majus, and also most important, supply the inner medial side of thigh. এটা মনে রাখতে হবে, because there is a reflex known as the cremasteric reflex. Explain করা যাবে এটা দিয়ে, পরে আসবো. So ilioinguinal nerve supply the sensory distribution to supply the anterior skin of the, মানে supply বলতে কি, carrying the sensation, pain, touch, temperature, heat, cold sensation through this branch, ilioinguinal nerve, and also the medial side of the thigh. So এইখানে যদি pinch করো, ilioinguinal nerve carry করবে, করে ব্রেনে পৌঁছাবে. And while they are passing here, this ilioinguinal nerve also supply the internal oblique and the transversus abdominis. So it is a mixed nerve. এইটা গেল, শিখে গেলাম, নার্ভ সম্বন্ধে একটা আইডিয়া হলো. নেক্সট হচ্ছে ভেসেলস. ভেসেলসের মধ্যে দুটো ইম্পর্টেন্ট ভেসেল শিখবে, সুপিরিয়র এপিগ্যাস্ট্রিক আর্টারি অ্যান্ড ইনফিরিয়র এপিগ্যাস্ট্রিক আর্টারি. সুপিরিয়র এপিগ্যাস্ট্রিক আর্টারি অলরেডি ইন থোরাক্স ইউ নো, কার ব্রাঞ্চ? হ্যাঁ, কি? ভেরি গুড, ইন্টারনাল থোরাসিক আর্টারি. এইখান দিয়ে যখন যাচ্ছে ইন্টারনাল থোরাসিক আর্টারি, in the sixth space it divided into musculophrenic artery and superior epigastric artery. This superior epigastric artery enters the rectus sheath and passing behind the rectus abdominis to supply the rectus and surrounding region. And the most important is the inferior epigastric artery. This is the abdominal aorta, which is divided into two common iliac artery at the level of the L4 vertebra, lumbar 4 vertebra, lower border of the L4 vertebra. It divides into abdominal aorta, two common iliac arteries. These two common iliac arteries again at the divided into internal iliac and external iliac artery. Here, internal iliac supply the by its branches to the pelvis and the perineal region. But external iliac artery here, it gives a branch known as the inferior epigastric artery and deep circumflex iliac artery. Inferior epigastric artery, very important. So inferior epigastric artery is a branch of the external iliac artery. External iliac artery continuation ki hoyeche? Femoral artery. External iliac artery branch of common iliac artery. Common iliac artery is a branch of abdominal aorta. Abdominal aorta is a continuation of thoracic aorta. A arch of ascending aorta, arch of aorta, descending thoracic aorta, then abdominal aorta, then here it divides into two common iliac arteries. Common iliac arteries again divided into external iliac and internal iliac artery. Internal iliac artery so many branches আছে, পরে পড়তেই হবে. আর internal iliac artery gives mainly two branches, superior inferior epigastric artery and deep circumflex iliac artery. Deep circumflex iliac artery অত important নয়. Superior epigastric artery then courses upward, and most important, it passes medial to the deep inguinal ring. That is very, very important. মনে রেখো এটা, এখন থেকেই মনে রাখো. It passes medial to the, আগেই বলেছিলাম, পেছনের দরজা, deep inguinal ring. What is deep inguinal ring? A oval deficiency in the fascia transversalis. Oval deficiency in the fascia transversalis. একটা কাগজের শীট নাও, মধ্যখানে ফুটো করো, that is the fascia transversalis. কাগজের শীটটা হচ্ছে, কাগজের পেপারটা হচ্ছে তোমার ফাসা, তার মাঝখানে একটা গোল ফুটো করো, that is the fascia, deep inguinal ring, near the inguinal region. And it passes medial to the deep inguinal ring, then it enters the rectus sheath just behind the posterior wall of the rectus sheath, তোমরা পরে পড়বে, and enters the rectus sheath and joins with the superior epigastric artery. So this inferior epigastric artery is a very important. So with this then now I going to the muscles of the abdomen. Rectus পড়াবো না, rectus sheath যখন হবে তখন পড়ব। নেক্সট, তাহলে আমরা দেখতে পাচ্ছি these are the arrangement of the muscles in the lower region of the abdomen. This is the external oblique, internal oblique, transversus abdominis, fascia transversalis, extraperitoneal fatty tissue containing blood vessels, and blue layer is the parietal peritoneum. Right? This is the deep fascia, fundiform ligament, and this is the scrotum. So these are the layers, 6 layers. আর ডিটেলস আজকে আর গেলাম না, পড়ে নেবে তোমরা, কালকে ডিটেলসে পড়িয়েছি fascia of Langher and fascia of Scarpa, কারণ আজকে করলে আর শেষ হবে না, কালকে ডিটেলসে পড়িয়েছি। Superficial fascia is the below the umbilicus, divides into 2 parts, fascia of Langher, superficial fatty layer, and deep layer fascia of Scarpa. Tracing of the fascia of Scarpa is very important. There is a no deep fascia, and this is the inguinal canal. Look, this is the external oblique, internal oblique, transversus abdominis. Look, internal and transversus form the roof, আর এই জায়গাটা আসবো ইঙ্গুইনাল লিগামেন্ট, যাকে ছেড়ে দাও, এখন বুঝতে পারবে না। রাইট, নেক্সট, ল্যাঙ্গার্স লাইন কালকে বলেছি, যারা যারা ছিলে, দিস আর দ্য ল্যাঙ্গার্স লাইন। হাউ ইট ইজ ফর্ম, কেউ বলো কালকে যারা ছিলে। দিস আর দ্য, ইট ডিনোটস হোয়াট, অ্যারেঞ্জমেন্ট অফ, এই তুমি ছিলে তো, বলো কি জিনিস এটা, কার জন্য লাইনটা হচ্ছে, কোন কানেকটিভ টিস্যুর জন্য, ফাইবার্সের জন্য, কোলাজেন ফাইবার্স। কোথায়, ডার্মিস, ডার্মিস অফ দ্য স্কিন, হিয়ার দ্য কোলাজেন ফাইবার্স আর অ্যারেঞ্জড প্যারালালি, হুইচ gives this line known as the Langher's line, and importance কালকে বলে দিয়েছি, ক্লাস না করলে আর কিছু করার নেই। নেক্সট, this is the umbilicus. দেখো এখানে একটা ইনসিশন হয়েছে, এবার Langher's লাইন দিয়ে দিয়েছে, কি ফাইন হিলিং করেছে, কিছুদিন পরে আর বোঝাই যাবে না। এটা হচ্ছে অপারেশনের জাস্ট পরে, আর ওটা হচ্ছে কিছুদিন পরে, ফলে আর বোঝাই যাচ্ছে না। নেক্সট, এইবারে দেখো ভার্টিক্যাল, Langher's লাইনের ভার্টিক্যাল ইনসিশন দিয়েছে, এরকম আগলি স্কার হয়ে যাবে। তবে এখন কিন্তু প্লাস্টিক সার্জনরা অত ইম্পর্টেন্স দেয় না, দে ডোন্ট গিভ সো মাচ ইম্পর্টেন্স অ্যাবাউট দ্য Langher's লাইন, দি ইম্পর্টেন্স গিভ অন্য, ছেড়ে দাও, বাট স্টিল দেখো কি বাজে স্কার হয়েছে। রাইট, এবং তুমি কিন্তু কনজিউমার প্রোটেকশন অ্যাক্টে পড়ে যেতে পারো যে এরকম আগলি স্কারের জন্য। নেক্সট, এই fascia of Langher and fascia of Scarpa, fatty layer. নেক্সট, ছেড়ে দাও, পড়ে দিয়েছি, ও ছিল সব। নেক্সট, পাল্টে দাও, পাল্টে দাও, তা একটুখানি পড়ে দিই, লাস্ট আর কালকে যারা পড়েছো ছবিটা দেখাইনি, নেক্সট আগেরটা ব্যাক। এই যে fascia of Scarpaটা দেখো, এখানে ফান্ডিফর্ম লিগামেন্ট করে এইদিকে পেনিসকে কভার করছে, fascia of পেনিস করছে, তারপর পেরিনিয়ামে চলে যাচ্ছে fascia collis হিসাবে, হয়ে যাবে, এটা ভয়ের কিছু নেই, তোমাদের পেরিনিয়াম যখন হবে আবার পড়ানো হবে। নেক্সট, এইটা হচ্ছে লিনিয়া আলবা, আর যেটা বলছিলাম পার্টলি মাস্কুলার, এইখানে এসে দেখো অ্যাপোনিউরিটিক হয়ে গেছে, হোয়াইট মেমব্রেন লাইক এক্সটার্নাল অবলিক মাসল, এটা দুটোই মাসল, but here it is an aponeurosis, so we call it aponeurosis of the external oblique. Next, and lineal bata দেখেছো তো কিরকম ডিসেকশনে। নেক্সট, ছেড়ে দাও, এইগুলি আর পরে পড়ানো হবে। আচ্ছা, নেক্সট এর থেকে দাও। আচ্ছা, এবার হচ্ছে খুব কুইক পড়াচ্ছি, এগুলি মুখস্থের ব্যাপার, শুধু ট্রিকি গুলিয়ে যেতে পারে কখন, যে কোনটা ওপর কোনটা নিচ। দেয়ার আর থ্রি, আমি রেক্টাস অ্যাবডোমিনিস পড়াচ্ছি না, ওটা রেক্টাস শীথ যখন হবে তখন পড়ানো হবে। There are three flat muscles in the anterolaterally. I have repeatedly telling you that is external oblique, internal oblique, and transversus abdominis. And as it is a muscle, we have to know the origin, insertion, nerve supply, action. Action is as a whole, because this muscle acts as a whole. Note there is a separate action. So, external oblique. External oblique origin from above and inserted in below. মনে রাখার জন্য বলছি, ইন্টারনাল অবলিক অরিজিন ফ্রম বিলো, ইনসার্টেড ইন অ্যাভাব। ট্রান্সভার্সাস অরিজিন, both external, both above and below their origin, and insertion is transversely to the from the rectus sheath. And ওটা তাহলে কি বললাম, এক্সটার্নাল অবলিক ইজ অরিজিন ফ্রম অ্যাভাব। অ্যাভাবে কি রয়েছে, রিবস, কস্টাল, তাই তো? অ্যাবডোমেনের অ্যাভাবটা কি, রিবস, কস্টাল, তাহলে কোথার থেকে নেই, 8। সো এক্সটার্নাল অবলিক মাসলস টেক্স অরিজিন, ফ্লেশি অরিজিন ফ্রম দ্য আউটার বর্ডার, আউটার সারফেস অ্যান্ড লোয়ার বর্ডার অফ লোয়ার 8 ribs. লোয়ার 8 ribs মানে কি, 5th, 6th, 7th, 8th, 9th, 10th, 11th and 12th বাই ডিজিটেশন। দেখো এইটাকে আমরা বলি ডিজিটেশন, ওই এক একটা আলাদাভাবে নিচ্ছে, যেমন সেরেটাস অ্যান্টেরিয়ার আলাদাভাবে নিচ্ছে, কিন্তু ব্রেকিয়ালিস কোনো ডিজিটেশন নয়, অ্যাজ এ হোল মাসলকে কভার করে নিচ্ছে। তো এইরকম ভাবে যখন মাসল অরিজিন নেয়, when this muscle takes origin by slips, ছোট ছোট স্লিপসে, তাকে আমরা বলি ডিজিটেশন। সো বাই 8 ফ্লেশি ডিজিটেশন, ফ্লেশি কেন, মাস্কুলার। এটা হচ্ছে জিফয়েড প্রসেস, এটা হচ্ছে সিম্ফাইসিস পিউবিস। তার আগে আমি বোনসে একটা জিনিস দেখাবো বাই রিক্যাপিচুলেশন, এটা খুব দরকার, এরকম ভাবে দেখাচ্ছি। ইট ইজ দ্য সিম্ফাইসিস পিউবিস, এইটা এইটা সিম্ফাইসিস পিউবিস। এই যে এইখানে যে গ্রিজটা রয়েছে, এইটাকে আমরা বলি পিউবিক ক্রেস্ট। কি বলি, পিউবিক ক্রেস্ট। তারপরে এটা হচ্ছে পিউবিক টিউবারকল। ভালো করে দেখো, পিউবিক সিম্ফাইসিস পিউবিস, পিউবিক ক্রেস্ট, গুলিয়ে ফেলবে না, পিউবিক টিউবারকল, তারপরে যে লাইনটা রয়েছে, ইট ইজ দ্য ইলিওপিউবিক এমিনেন্স। মনে পড়ছে? এই যে লাইনটা রয়েছে তাকে বলে পেকটেনিয়াল লাইন বা পেকটেন পিউবিস। So pubic crest and pecten pubis are not same. So medial to lateral jai, symphysis pubis, pubic crest, very important, pubic crest, pubic tubercle, and it is the pectineal line, which ultimately goes to the iliopubic eminence. This is the pectineal line, long line, it is the medial part, it is the lateral part of the pectineal line. এইটুকুনি জানলে হয়। And this is the iliac crest. Iliac crest হচ্ছে outer anterior 2/3 and posterior 1/3. It is the anterior 2/3, posterior 1/3. It is the outer lip. This is the intermediate lip. It is the inner lip. Outer lip, intermediate area, and inner lip. Right. This is the anterior 2/3 of the iliac crest. This is the symphysis pubis. This is the pubic crest, pubic tubercle and pectineal line. এতটা দিলে হবে না, আরেকটু দূরে সরাই। এটা pubic tubercle. So after their fleshy origin, from the 5th, 6th, 7th, 8th, 9th, 10th, 11th, and 12th, they takes their origin and they become muscular here. They become muscular. And the direction of the fibers are like that, as if you put your hands in the pocket. Downwards, forwards, and medially. Downwards, forwards, and medially. This is the direction of the fibers, like the external intercostal. Now, in a italicized ape pattern, এটা গেল অরিজিন, এরপরে হচ্ছে ইনসারশন। ইনসারশন কি বলেছি? বিলো। খুব ভালো করে এটা শোনো। মোস্ট posterior and lower fibers directly inserted into the anterior 2/3 of the outer lip of the iliac crest. এটা anterior superior iliac spine. এটা anterior superior iliac spine. So the most posterior fibers directly inserted into the outer lip of the anterior 2/3, in the outer lip of the anterior 2/3 of the iliac crest, এই জায়গাটায়। Right? And after that, it becomes aponeurotic. এই জায়গাটা অ্যাপোনিউরোটিক হয়ে গেল। অ্যাপোনিউরোটিক মানে কি? ফ্ল্যাট মেমব্রেন লাইক হয়ে গেল। And they are inserted into the, from the aponeurotic of the aponeurosis, they covers the rectus abdominis muscle and form the rectus sheath, anterior wall of the rectus sheath. And they are inserted into the rectus abdominis, to the linea alba. তাহলে একটা ইনসারশন হলো এখানে, আরেকটা কি করলো? এরম ভাবে গেল গিয়ে they are inserted into the linea alba. Before their insertion, they covered the rectus abdominis muscle. এখানে rectus abdominis muscle রয়েছে। They covered the rectus abdominis muscle to form the anterior wall of the rectus sheath. The sheath covering the rectus abdominis muscle, both anteriorly and posteriorly, we call the rectus sheath. Come on. এইটা যদি rectus sheath হয়, এটা হচ্ছে rectus abdominis muscle. Come on. এইটা ধরো rectus abdominis muscle, they are covered by the anterior wall and posterior wall of the rectus sheath. So this is the sheath, a plastic membrane, polypack. Come on, big shopper, cover করে রেখেছে, তাকে আমরা rectus sheath বলি। তাহলে কে ফর্ম করছে? anterior wall, partly formed by the external oblique muscle. After they are covering the rectus abdominis, they are inserted to the xiphoid process, then the linea alba up to the symphysis pubis. এরপরে খুব ভালো করে শোনো। Then the lower border of the, so lower border টা এখানে ফ্রি রয়ে গেছে, lower border টা ফ্রি। This lower border become folded on itself and form a ligament known as the inguinal ligament. So what is inguinal ligament? This is the folding itself, এরকম ভাবে ফোল্ড হয়ে যায়। এই অ্যাপোনিউরোসিসটা এরকম ভাবে কার্ল হয়ে ফোল্ড হয়ে যায়। and this is the inguinal ligament. এখানটা গিয়ে এরকম ফোল্ড হয়ে অ্যাটাচমেন্ট কি ইঙ্গুইনাল লিগামেন্টের অ্যান্টিরিয়র সুপিরিয়র ইলিয়াক স্পাইন টু দ্য সিম্ফাইসিস পিউবিস। এই হচ্ছে ইঙ্গুইনাল লিগামেন্ট। এই পিউবিক টিউবারকল, সরি, anterior superior iliac spine to the pubic tubercle. So inguinal ligament is nothing but a part of the external oblique muscle, and this inguinal ligament has got some extension. Through this extension, through these derivatives, they also attach to the pubic crest and also the peritoneal line. What are the extension? I will come later on. So these are the origin and insertion of the external oblique. এইগুলি হচ্ছে এক্সপানশন, পরে আসবো, এক্সপানশন অফ দ্য ইঙ্গুইনাল লিগামেন্ট, ডেরিভেটিভস অফ দ্য ইঙ্গুইনাল লিগামেন্ট। ইঙ্গুইনাল লিগামেন্ট থেকে আরো কিছু কিছু এক্সটেনশন হয়, কেমন? সেইগুলি হচ্ছে এগুলি ল্যাকুনার লিগামেন্ট, রিফ্লেক্টেড পার্ট অফ দ্য ইঙ্গুইনাল লিগামেন্ট, পেকটেনিয়াল লিগামেন্ট। এরপরে একটা খুব বড় জিনিস বলার আছে, এই জায়গাটাকে আমি বড় করে আঁকছি। দ্যাট ইজ দ্য সিম্ফাইসিস পিউবিস, দিট ইজ দ্য কি বললাম এটা, pubic crest, and it is the pubic tubercle. So aponeurosis of the external oblique is attached here, and it forms the, here is the inguinal ligament. এইবারটা খুব ভালো করে শোনো, এই যে গ্যাপটা from the symphysis pubis to the pubic tubercle, which is by the pubic crest, again there is a gap, triangular gap in the external oblique muscle, triangular gap, কিছুটা হেলে পড়া, there is a triangular gap of the external oblique muscle, আর এইখানটায় রয়েছে তোমার স্ক্রোটাম, আর এইখানটায় রয়েছে টেস্টিস, স্পাইনাল পাম। ফিমেলের ক্ষেত্রে নট ইম্পর্টেন্ট, লেবিয়া মেজর্স রয়েছে। আচ্ছা, দেয়ার ইজ এন ট্রায়াঙ্গুলার গ্যাপ ইন দ্য অ্যাপোনিউরোসিস অফ দ্য এক্সটার্নাল অবলিক, and this is called, this gap, triangular gap is called the superficial inguinal ring. So superficial inguinal ring is the lower gap in the lower part of the external oblique. Deep inguinal ring is the gap in the fascia transversalis, which is present more posteriorly. কেন? পরপর লেয়ার্স যদি যায় আমরা কি পাচ্ছি? প্রথমে এক্সটার্নাল অবলিক, পেছনে fascia transversalis, তাই তো? লেয়ার্স যদি দেখি, skin, superficial fascia, then the external oblique, internal oblique, transversus abdominis, then fascia transversalis. তাহলে superficial inguinal ring present anteriorly because it is gap in the external oblique, and deep ring is present posteriorly. Posteriorly মানে এতটা নয়, একটুখানি, because it is a gap in the fourth layer, fascia transversalis. গেল? So it is a gap in the, it is the superficial inguinal ring, so it is a triangular, and it is called a medial crus or a upper crus, একই নাম। এই যে এই দিকটা রয়েছে একে বলা হয় মিডিয়াল ক্রাস, ইট ইজ আ মিডিয়াল সাইড, এটা ল্যাটারাল সাইড, এটা আপার আর লোয়ার, এটাকে আমরা আপার ক্রাসও বলতে পারি, মিডিয়াল ক্রাসও বলতে পারি, এইটাকে আমরা ল্যাটারাল ক্রাস বা লোয়ার ক্রাস বলতে পারি। and base is formed by the pubic crest. Through this superficial inguinal ring comes out the spermatic cord, and এই মাত্র বললাম একটা নার্ভ বেরিয়ে আসে, কি নার্ভ? ইলিও ইঙ্গুনাল নার্ভ। ইলিও ইঙ্গুনাল নার্ভ এখান দিয়ে বেরিয়ে আসে, ইলিও ইঙ্গুনাল নার্ভ বেরিয়ে আসে। And what is spermatic cord? So, and these two crus is hardly joined by a few মাকড়সার জালের মতো কিছু intercrural fibers দিয়ে যোগ থাকে, not important. শুধু জানবো superficial inguinal ring is present just over the pubic crest, 1.25 centimeter above the pubic tubercle. It has got a lateral crus and a medial crus, or upper crus and lower crus. Through this opening comes out the spermatic cord and the ilioinguinal nerve.